Good afternoon and welcome to Let's Chat with Dr. Celeste, MD. I'm your host, Dr. Celeste Reese-Willis. I am your board-certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions for their acute and chronic medical needs. We do this through primary care, telemedicine program, concierge medicine program, COVID-19 testing, as well as COVID-19 vaccines, as well as through our weekly segment on CBS 42 News, House Calls, which is every Monday morning. We're on this morning, so I hope you're able to log on to catch that. We will post a replay of this morning's episode. So good morning, ladies and gentlemen. As many of you know, it is Breast Cancer Awareness Month. The month of October is. So we're sorry that we did not get to air on last Monday. We actually were having some technical difficulties in the building, and we're not able to connect due to a fire alarm that was dispelled on last week in our office. So weren't able, but everyone was fine. No one, no injuries or things of that nature, but we weren't able to come to you live. So all of our topics this month for Let's Chat will be centered around breast cancer. We've moved to a new day and time. We have been coming to you live every Sunday at 3 p.m. for over a year and a half. And so in an effort for Dr. Celeste to get better self-care, we have switched to Mondays so that we'll have more time for our families on Sundays and better times for self-care. So hope that you guys are still able to share this information and it's helpful for you. Good afternoon, Mr. Cleveland. Thank you for joining us. So what I thought we'd do with breast cancer is we're going to talk about breast cancer and some of the signs and symptoms, but I would like to dispel some of the myths surrounding breast cancer, as well as to bring awareness in different areas and things that we might not be thinking about when we think about breast cancer. So today's topic is breast cancer and the age at which that you get breast cancer. 1 in every 8 women will be diagnosed with breast cancer during their lifetime. 85% of breast cancers are in women who have no family history. A lot of times we think, or a lot of times what's said is, oh, you have family history, so you can't get it unless you have family history. So that's the first myth to dispel, is that you can get it without family history. We'll go into that a little bit more when we talk about our family history episode regarding breast cancer awareness, which will be in the next 2 weeks. Okay, so the median age at which people get breast cancer is 63 years old. So that means if that's the medium, that's in the middle, that half the people get it before 63 and half will get it or be diagnosed after the age of 63. So that's a lot of women for half of them to get it before they turn 63. 11% of all breast cancers happen in women that are less than 45 years old. And so on average, there are about 1,000 women that are less than 40 years old each year that die from breast cancer. So we want to highlight the fact that just because you're a younger woman doesn't mean that you don't have to be concerned about breast cancer. It's the very opposite. Every woman should be concerned about breast cancer. 1 in 8 women get breast cancer. So there's a reason for us to definitely bring awareness and to be concerned and to make sure that we get our appropriate screenings at the appropriate time. And I know that we're still in the pandemic, hopefully headed in the right direction. We pray. But we need to make sure we're still getting these screening exams. They're very, very important. And that's one of our office phones, sorry. So people that are at increased risk for breast cancer are people that have had a personal history of breast cancer, people that have family history of breast cancer, people that have family history or of ovarian cancer, because ovarian cancer is a hormonal type of cancer, or people that have a history of radiation to the chest. So the first thing that we want to talk about is the fact that a lot of young women think that they can't get breast cancer because they're so young. One of the reasons that we have so many younger women dying from breast cancer, though, and those are the 3 topics that we're going to talk about today, and that is, number 1 is that the diagnosis is difficult or challenging at times because younger women have more dense breast tissue. So that may make it more challenging to kind of see the breast tissue to make sure that it's okay. So that's the first, and that is the diagnosis can be challenging in a younger patient because of more dense breast tissue. Number 2, breast cancer in young women tends to be more aggressive than breast cancers that are found in other groups of women. So a lot of the breast cancers that we're seeing in younger women are more aggressive. That's another reason that we should try and stay on top of it and make sure that we're getting the appropriate screenings and making sure that we know our family history. Knowing your family history is very, very important, especially in relation to breast cancer. Okay? Number 3, ignoring the warning signs. A lot of times, because they're younger women, there are warning signs or symptoms that sometimes people get with breast cancer, such as, not limited to, but such as discharge from the nipple, a change in the appearance of what your breasts may look like when you look in the mirror. Those are things that you may not think much of it because you're younger and you feel like, I'm too young for breast cancer. That has happened in younger women before. So we want to make sure that we stay on top of that. So again, those 3 things that have contributed to younger women dying with breast cancer at younger ages. Number 1 is the diagnosis being more challenging or difficult because of that dense breast tissue. Number 2 is that the breast cancers in younger women tend to be more aggressive. And then number 3, sometimes we ignore the signs and symptoms simply because people feel like, we're too young to get breast cancer. So we want to make sure that we pay attention to this, that we do our appropriate screenings. If you have family history of breast cancer, you want to make sure that you have a meeting or consultation with your physician to find out when is the right time for me to get a mammogram. That is the question that you want to ask. Each year, women should have annual exams with their gynecologist, and women should be doing their own monthly self-breast exam every month, best after your cycle, because that's when the hormones are done with their oscillation, and less of a chance that it'll be something hormonal that you felt, or your breast tissue being affected rather by those hormones. So we want to make sure we do our monthly breast exams after our menstrual cycle for the month, So we want to make sure we do that breast exam after the menstrual cycle for the month, and we also want to make sure that we're doing that annual exam with our physician. During that time, your gynecologist or regular physician will explain to you when is the appropriate time for you to be tested for breast cancer. Please make sure that you talk to your family about what you have a history of. And then lastly, don't forget that men can get breast cancer. We will talk about that on one of the next episodes of Let's Chat. That's all we had to share with you guys today. Does anyone have any questions? I hope this information was helpful. If it's been helpful for you, please share it with your family or friends. We will be coming to you live again. Our Let's Chat time has changed from Sunday at 3 p.m. We're now on at Mondays. Every Monday at 12 noon, we'll try and bring you a quick little snippet at the beginning of the lunch hour. Okay? So if you are in need of COVID testing or COVID vaccinations, we provide those at our office. You can reach us at 205-291-8842. If you're in need of COVID testing, you can also get an appointment on our website at drceleste.c19.com. That's drceleste.c19.com. That's all we had to share with you guys today. I hope this has been helpful. Next week, we will talk about breast cancer. But this time when we talk about breast cancer, we're going to talk about breast cancer in men. Okay? Let's talk about breast cancer in men. So we'll do that with you guys on next Monday. Anyone have any other questions? Yes, men can get breast cancer. Okay? So I hope everyone is doing well, having a happy Monday. And that's all we had to share. Again, you can reach us for COVID testing or vaccines at 205-291-8842. I am Dr. Celeste, your board-certified family medicine physician, favorite urgent care physician, coming to you live from Birmingham, Alabama. If you're in need of any testing, you can reach us at the number of the website listed below. Happy Monday, everybody. Bye-bye.